kidding. Does that feel like
Be respectful of us, be respectful of debaters, no hooting, hollering, personal attacks, and just have fun, enjoy yourselves. Also, we are going to be recording in the back, so no one else can be recording or doing audio or visual. We will give the recording to anyone that wants it, but we are just keeping it to us, so don't want to see any photos. Amazing. Then let's get started. So they all drew numbers randomly on the hat to decide which order they'll be going in. So we'll start with the first group. You have 3 minutes to present your statement. What? Oh my God, I'm so sorry. Before we get started, we're going to have a couple delegates from SAG talk a little bit about an overview of healthcare in America as gone up till now, the state of our healthcare system. So that way we can all make sure we're on the same page in terms of backing info.
So before the 4 student groups start presenting their policies, we're going to give a little bit of overview like Maya said. So welcome again. Thank you for coming to 6 Student Debate Night. It's slightly ironic that we're meeting in and out while we're discussing healthcare, but you gotta do what you gotta do. Nate is going to present a general overview of healthcare in the United States.
So, for some general information, U.S. healthcare spending grew by 3.9% in 2017. Louder? Okay, perfect. For some general information about the U.S. healthcare system, U.S. healthcare spending grew by approximately 3.9% in 2017, reaching $3.5 trillion total, which breaks down to $10,000 to $10,739 per capita. As a share of the nation's GDP, healthcare spending accounted for 17.9%. This is significantly higher when compared to other countries, but the U.S. is not necessarily healthier when measured by infant mortality, life expectancy, and other common measures of health. I.e., this can mean U.S. healthcare spending may not be efficient, especially compared to other countries like Canada, who spends about 10.4% of their GDP, the UK 9.9%, and the OECD average being $4,000 per capita. Insurance coverage in the U.S. in 2017 was 49% through their employer, 21% through Medicaid, 14% through Medicare, and 9% were uninsured.
So next we're going to talk about Medicare, Medicaid, and the Affordable Care Act. So first, Medicare plays a key role in providing health care and financial security to 60 million elderly Americans and younger people with disabilities. And it helps to pay for many medical services such as hospitalizations, physician visits, prescription drugs, and nursing facilities. And looking ahead, the CBO projects Medicare spending to grow from $580 billion in 2018 to $1,200 billion in 2028. And that can be attributed to the aging of the population, the baby boomer generation, and increases in per capita healthcare costs. And restructuring Medicare benefits and cost sharing has been suggested by the public and politicians, as well as raising Medicare eligibility age so that people under the age 65 cannot buy into Medicare, so different policy changes have been suggested.
And then you also have Medicaid, which is the healthcare program designed for people with low income in the U.S. This covers about 1 in 5 Americans, and for fiscal year 2017, Medicaid covered over 76 million low-income Americans. With the ACA expansion in 32 states, about 12 million people were newly covered as of fiscal year 2017. By ACA, of course, I mean the Affordable Health Care Act. Children account for more than 4 in 10, about 43% of all Medicaid enrollees, and the elderly and people with disabilities account for about 1 in 4 enrollees.
And so the 3 main goals of the Affordable Care Act were to make affordable health insurance available to more people. And the law provides consumers with subsidies that lower costs for households with income between 100% and 400% of the federal poverty line. And the second goal was to expand the Medicaid program to cover all adults with income below 138% of the federal poverty level. But since Medicaid is a federal state program, not all states have expanded their Medicaid programs. And the third goal of the Affordable Care Act was to support innovative medical care delivery methods designed to lower costs of healthcare generally. And in 2014, there was an average of 5 insurers participating in each state's Affordable Care Act marketplace. And in 2018, this average dropped to 4 insurance companies per state. But this number varies by region.
The number of uninsured non-elderly Americans decreased from over 44 million in 2013, which was the year before major coverage provisions went into effect, to below 27 million in 2016. However, in 2017, the number of uninsured people increased by nearly 700,000 people, the first increase since the implementation of the Affordable Care Act. Studies repeatedly demonstrate that the uninsured are less likely than those with insurance to receive preventative care and services for major health conditions and chronic diseases.
So some of the questions you might want to be thinking about as you listen to the student groups are how should we tackle rising costs of insurance, drugs, hospital care, etc.? How do we want to improve quality of care, because higher cost does not necessarily mean higher quality of healthcare? How do we want to reduce inefficient spending? And what is the best way to fund Medicare and Medicaid? Thank you.
Thanks. So to start opening statements, they each drew out of the hat, and the review will be going first for their intro.
Evening, everyone. Thanks for coming here to pontificate. Democrats are right to bemoan American health care. Prices skyrocket, you get sick, you might lose your insurance. Republicans, though, are right to fear the centralization of medicine in an impersonal, inefficient, and crony bureaucracy that'll thrust long waiting lists on patients. For years, Republicans rightly focused on Obamacare's unintended consequences, mangled incentives, and exploded budgets. But once they gained full control of government, Republican congressmen, let alone the president, seemed totally incapable of articulating a solution to some genuine problems. So what's the complete answer? Healthcare dysfunction is a product of well-meaning but naive past government regulations which protect providers from competition. Certificate of need laws, corporate practice of medicine laws, and a litany of occupational licensing laws protect the profits of existing hospitals, restrict the supply of doctors, and inflate prices. And we could go through each of those laws more in detail later. But the idea that the government can reduce these costs by negotiating harder or telling businesses what to do is a triumph of hope over centuries of experience. We need to unleash the forces that in other industries brought us Southwest, Amazon, and Apple. Only disruptive competition, where new businesses drive out old ones, will bring efficiency, lower costs, and innovation. So what about pre-existing conditions? Health insurance should be individual, portable across jobs and state lines, and come with the right to continue with no unexpected increases in premiums if you get sick. Companies want to sell that kind of insurance. In fact, United used to. We want to buy that kind of insurance as consumers. Where is it? Why doesn't it exist? The government killed it. For one, they only subsidize employer-provided group insurance, not individually purchased insurance. And by law, insurance can't be sold across state lines. So thus, we get the pre-existing problem, because anyone who ever plans on moving, anyone who ever plans on getting a job, just gets job-dependent and short-term insurance. Yes, there has to be government-provided care for the poor, and a competitive, innovative market will make those subsidies more affordable. We can talk more later about how that's given, but I think that's a key part of this equation as well. Problems in healthcare are real. But more government intervention that manipulates prices and throws in mandates is counterproductive and part of why we're here in the first place. A market-based, deregulation-focused reform is not only possible, but the most likely solution to make life-saving care possible to Americans of all backgrounds. Thank you.
Oh, yeah. Hi, I'm Jacob Cooperman, and I'm representing the Stanford Young Democratic Socialists, and I'm excited to be here. Our thesis is simple. The current way the healthcare system is set up in America is killing people through lack of coverage and financial burden every year, and leaving millions upon millions more with inadequate care, or saddled with life-changing medical debt. We spend the most per capita of any country, but we lag behind countries with similar standards of wealth and development in metrics like infant mortality, life expectancy, and overall quality of care. The system is clearly not working. I mean, if the Democratic Socialists and the Review can agree on that. It's clear that the system is not working. And we also agree with the Review that a large part of the system, a large part of the reason why the system isn't working is because it's an unworkable kludge of all these different compromises between a market system and government regulations and all these different steps taken over the years to adjust it in one way or the other. And that's why the solution to the American healthcare system in its current state is to get rid of private insurance as it stands currently. The private insurance system in America doesn't work. It doesn't work as well as systems in countries with single-payer systems. It doesn't work even as well as countries with systems like Germany. And so the plan we propose would be a Medicare for All plan, where all Americans are enrolled in the same plan that would cover everything from basic hospital visits and checkups and preventative care to long-term, like, outpatient care. And of course people are going to ask, oh, how do you pay for this plan? And the fun thing is, establishing a Medicare for All system would cost less than the current healthcare system in America. Based on a study by the Libertarian Mercatus Institute, found that costs for establishing a Medicare for All system would be $32.6 trillion over the next 10 years. That seems like a lot, but that is $2 trillion less than what the projected costs of American healthcare are currently over the next 10 years. Establishing Medicare for All would save money through administrative costs, and would save money through all these different mechanisms. But I don't really want to talk about that. I want to talk about how Medicare for All would unlock the freedom, would unlock new freedoms for Americans. Would allow them to leave a system that ties them down to jobs or within state lines, ties them down to plans healthcare plans they don't even like, just because they need health coverage. Medicare for All would fundamentally change the way healthcare works in America. And we need that change. Thank you.
Ooh, me. All right, okay, all right. All right. All right, hello everyone, my name is Stephen Sills. I'm here representing the Stanford College Republicans tonight. Okay, and so again, we hear a lot about the practicality of big government so-called solutions to the U.S. health insurance epidemic in the United States. Terms I'm sure you've heard of: Obamacare, single payer, Medicare for all. Today I will show you how all these big government ideas are both unfeasible and impractical throughout this debate. But it's not just the impracticality of these solutions, but their blatant immorality. Why? Because Obamacare fundamentally and single payer are fundamentally wealth redistribution schemes to provide money, to take money from one person to provide for another. And that is fundamentally a massive theft scheme. Let's start with Obamacare. Socialism is pervasive throughout Obamacare. But most importantly, like the socialist promise of healthcare as a right, the promise is ultimately one that the government cannot keep. Who are we to trust what the government promises to its people? Barack Obama made a promise. Barack Obama lied. He told millions of Americans on the campaign trail that if you liked your plan, you could keep it. 26 million Americans had their health insurance stolen from them, had their premiums and deductibles increased by 97 and 147%. Now young, healthy people are now punished for their responsible, healthy lifestyle decisions, and poor and middle-class income families see their premiums swallow up by over 10%. Who was hurt? Our society's most underprivileged, depriving them of the fruits of their labor, taking away their income, taking away their doctor, the health insurance plan. That is theft. Healthcare cannot be a right if what it demands is the violation of other people's rights. And now, low-income individuals are trapped on a public healthcare system where their healthcare claims are not accepted, their healthcare outcomes are worse, their mortality rates are higher. That is the legacy of the Unaffordable Care Act. High premiums and mortality. Then we move on to single payer. And now what do we see from the radical and unhinged left? You have the DSA that says Obamacare doesn't go far enough, doesn't take enough. Not enough people kicked off of their healthcare plan. Not enough wealth stolen. Not enough healthcare treatment denials. Not enough mortality. Now they want to take it further to consolidate full control of the government. And to complete the circle and fulfill the government's naive promise of healthcare as a right, which can only lead ultimately to rationed healthcare, denial of treatment, denial of life-saving drugs, all for the detriment of our nation's healthcare. The promise of healthcare as a right, though, isn't really anything new. It's a promise that Vladimir Lenin promised to his people in the USSR in 1920. But as with all failed promises they can't fulfill, it takes the promise of Soviet-style bread lines and transfers them into our healthcare system. There has to be something better than this, and it is found in the Medicare innovations and quality treatments found in our U.S. system. Thank you.
Hi everybody, my name is David Jaffe, and today I'll be speaking on behalf of the Stanford Democrats. And I'd like to preface everything that I say. I'd like to preface everything that I say with that the views that I'll be expressing tonight are my own. I can't even begin to fully express the views of everybody